My name is Pierre Michel Llorca. I'm professor of psychiatry in Clermont-Ferrand, France, and I've been working with schizophrenia patients for many years. Schizophrenia is rather well known by general population, but also psychiatrists, a psychiatric illness, and that begins during the youth age, and that will associate what we call positive symptoms, meaning delirious and hallucinations, negative symptoms that can describe with anhedonia, emotional blunting, social withdrawal, and also what we call disorganization, meaning the difficulty to organize the thoughts and the expression of speech. And all those different clinical dimensions associated are inducing an impairment in functionality for patients and there's a lot of variation. One of the other aspects is the fact that schizophrenia is rather chronic illness, and that is not so easy to obtain remission. There's a lot of myths around schizophrenia. Most of the people, when they are asking questions about schizophrenia, may speak about dangerosity, and it's very frequently associated with different movies in which you have this kind of very murderous schizophrenia patients, but also about the difficulty to predict the behavior of schizophrenia patients. And at the end, the global idea that it's impossible to treat schizophrenia patients and they will remain ill for all their life. And I think it's important to know that these are stereotypes. There are patients suffering from schizophrenia who have chronic evolution, but we know that we can obtain remission, clinical remission, and also functional remission for patients. And most of the patients, the vast majority of patients, are not dangerous at all. And they can be very frequently victims in our society, which may be very violent sometimes. And they are not unpredictable because we can predict their behavior when we know the way they will react in different situations. Schizophrenia is, because of the different kind of clinical dimension that can be associated, has an impact on the everyday functioning for the patients that are suffering from it. Because they have difficulty to interact with other people according to negative symptoms. They may have difficulty to plan their action because of disorganization. Sometimes it's very difficult for patients to interact, to build affective relations, sometimes to work or have a productive work. But we know that treatment, pharmacological treatment, psychosocial treatment are very important and may help to obtain clinical and functional remission. Schizophrenia patients are suffering from a very debilitating illness that can be improved. And on the other hand, they are suffering from stigmatization. So patients suffering from schizophrenia have to face the need for treatment, pharmacological treatment, psychosocial treatment, and the need for all the improvement training for the interaction with the other people, family, but also when they want to work. So they have to face how to deal with the symptoms and to improve their functioning in everyday life. On the other hand, they have the burden of stigmatization. And we have described the stereotypes around schizophrenia, and those stereotypes are something that is difficult to deal with for the patient, because most of the patients will suffer from this kind of stigmatization by all the people around them. So it's really a challenge to build a new life, to reach clinical and functional remission, and to suffering from these symptoms and stigmatization. And that's why we need to improve the treatment, we need to optimize the treatment, but we need also to fight against stigmatization and all the stereotypes around schizophrenia. Schizophrenia is very frequently associated with difficulties of interaction in family because of the symptoms, because of the interaction, because sometimes of the difficulty to express emotion. And family burden when a member is suffering from schizophrenia is very important. But we know that psychoeducational programs, including families, are very important, just in order to give information to the family members what is schizophrenia, what can be the symptoms. For example, negative symptoms is not laziness. And there's very frequently in young people the idea by parents that they are lazy, and not that to the understanding of the fact it's only related to the symptoms of the illness. So it's important to promote psychoeducational groups, but also peer interaction, and also all the way of giving them the possibility and the competence for the family member to interact with the member of the family suffering from schizophrenia. Reducing the stigmatization of schizophrenia is not an easy task because it's relying on stereotypes which are very, very old and structured. And we have a lot of this kind of false idea about schizophrenia. So we need to develop information. We need to develop education. We need to, for example, educate journalists that are sometimes describing schizophrenia patient as very dangerous patient in articles. And they are not thinking it's bad, but they don't understand that they stigmatize patients like this. And stigmatization is also something that induces in patient self-stigmatization. Patients, they don't appreciate the fact that they are able to develop competence and interaction. So it's really a challenge. Not easy to face, but I think it's a real great challenge for all the society to develop all the information programs and destigmatization program that we can do for the best for the patient and their families.